CNP featured research. This is your Diet Mental Health Break, number 57, brought to you by the Center for Nutritional Psychology. 2 minutes to learn and be good to yourself. Integrating nutrition into mental health care. Current training, beliefs, and future directions. There is growing recognition of the intricate, bi-directional relationship between diet, psychological processes, experience, and mental health outcomes, highlighting the need for formalized, systematic efforts to interconnect the psychological and nutritional sciences. The Center for Nutritional Psychology is the leading nonprofit educational organization consolidating the world's research connecting the psychological and nutritional sciences. Building a growing repository of research spanning multiple disciplines, CNP's efforts are lighting the path forward in the development of novel, interdisciplinary evidence-based language, education, and training for mental health and nutrition professionals. These efforts support the foundation needed to begin systematically integrating a nutritional component into mental health care and provide increasing opportunities for collaboration between mental health and nutrition professionals. For this Diet Mental Health Break, members of the CNP team have consolidated findings from studies surveying mental health professionals and nutritionists to illuminate barriers preventing collaboration between them. Here's what they found. Current training and practice gaps. Collaboration between psychologists and dietitians is increasingly recognized as critical. In fact, nearly 100% of psychologists and dietitians surveyed indicated that collaboration between the two disciplines would improve patient care. However, less than 20% of psychologists surveyed had received nutrition education at the undergraduate level, and only 2% had any graduate-level nutrition training. Nevertheless, most, 92.1%, discuss nutrition with clients, and many recommend dietary strategies or supplements. The overwhelming majority, 90%, express a desire for further education, highlighting a significant training gap. While 100% of psychologists surveyed agree that diet and mental health have a bi-directional relationship, they indicated the following key barriers in integrating nutrition into mental health care. Lack of formal education, formal training, and professional confidence. Concerns about overstepping professional boundaries. Lack of an interdisciplinary language through which to communicate. Time and resource constraints in clinical practice. Fear of triggering body image or weight-related issues in clients. Lack of clear interprofessional communication. Educational initiatives and scope of practice. While psychologists are not licensed to provide nutrition-based diagnoses or interventions, and dietitians are not licensed to diagnose or treat mental health disorders, both professionals benefit from evidence-based psychonutritional education within their professional licensure boundaries. Developing an evidence-based theoretical framework drawing from the psychological sciences while building strong links to the nutritional sciences has led to the development of novel psychonutritional education and training for professionals in both disciplines, equipping them with enhanced skills to address the interconnected challenges of diet, obesity, and mental health. This is CNP's mission and scope embodied within nutritional psychology. Key takeaways. Psychologists increasingly recognize the bi-directional relationship between diet and mental health. While few currently have formal education and training in this area, most desire this education. Evidence suggests interdisciplinary collaboration can improve clinical outcomes, and preliminary precedent exists in educating clinicians while maintaining clear professional boundaries. Interprofessional collaboration between psychologists and dietitians is gaining momentum through organized, systematic efforts by the Center for Nutritional Psychology. Adopting the evidence-based theoretical framework within nutritional psychology, linking the psychological and nutritional sciences, establishes a strong foundation for interdisciplinary education between mental health and nutrition professionals, and a shared language through which to communicate and collaborate. This approach enhances their ability to address the increasingly complex challenges of today's diet mental health landscape. By advancing the interdisciplinary field of nutritional psychology, professionals can deepen their understanding of the complex interactions between diet and psychological processes, ultimately improving patient outcomes. This also provides expanded depth in training mental health and nutrition professionals within more modern, holistic models of mental health care. Read the full CNP original article, Integrating Nutrition into Mental Health Care, Current Training, Beliefs, and Future Directions on the CNP website. This CNP conceptual article is brought to you by the Center for Nutritional Psychology. Visit us at www.nutritional-psychology.org and join us in our mission to support the inclusion of nutrition within mental health care by 2030.